Now, one of the areas that has led to the faster growth in GIS, of course, has always been health. And why do we say health? If you recall from first principles of geography, where we normally say that everything is related to everything else in space, but more, closer things are more related. The same approach has been used, particularly in health, especially when understanding the behavior of people, the transmission of diseases, and this falls in the category of what we refer to as epidemiology, which is about the place and time of diseases. So that is what epidemiology is, or spatial epidemiology, which now focuses more on the spatial covariates. So many years ago, the person who actually contributed largely, or rather is attributed to the growth in GIS, is a gentleman by the name of Robert Snow. So if you've ever taken an epidemiological course or studied GIS in health, then you might have come across this classical case study of a gentleman who tried to look into the spread of cholera cases in Broad Street, London. And at the time, just to bring it into context, at the time, there were a number of deaths and nobody knew what was causing the deaths, because cholera was perceived to be an airborne disease. And so what he did was basically to visit households and then record the number of deaths in every household. Then later on, he had the numbers of deaths. He came up with a very simple map, which is what I'm projecting on the screen. And he plotted those number of deaths based on where he had recorded them, the street intersections where he had recorded them. And so this actually led to what we call, he started exploring what could be the, causality or the cause of the trends he was observing. And then he started to, geographically map out features within that space. One of the features that he mapped was there was a cemetery, and since it was it was always perceived that this disease was caused by it was airborne, so he wanted to see how this relates to cemeteries, and he also mapped out the water pumps, etc. So there were so many things that he actually put on the map. Then visually he started to see the trend that most of the high concentration of deaths were focused on where there were water pumps, and then he went further and investigated what could have been the potential cause. Then he realized that the water that was being supplied to the households came from different sources, and one of the sources was contaminated, and that actually revolutionized GIS as a tool, not just for studying diseases, but for creating new body of knowledge. So you can imagine the transitioning and acceptance of the fact that this was a waterborne disease, which at the time was held to be airborne. So since then, there has been several applications of GIS in health, and I'll be speaking more to that today. So if we dissect GIS into just, the different components of GIS, and when I'm referring to GIS here, I'm referring to the science aspect of it, geographic information science. So you have a component that entirely deals with data capture. You have another component that deals with data storage and analysis. And of course, you have another component that deals with the visualization of information. So across each of these components, if you narrow it down to health-related application, which is our primary focus, then you're going to see the tremendous growth over time. So if we pick, for instance, the capturing of information or geographic information, from the perspective of health, we have these digital watches or Fitbits. You have the Samsung Fitbit, you have the Apple Watch, and there's so many right now in the market. And what these gadgets do is that they are related. They are somehow linked. They have sensors that are able to detect vibrations in your body. So if your heart is beating, they're able to detect the heartbeat rate and record that information. Of course, you can also supply some information to these applications, you can key in your weight and height, and then it will compute for you. It will compute for you your BMI and stuff like that. And one advantage of this platform, of these gadgets in the realm of health is, so one of the advantages in the realm of health is the fact that it also stores your not just your vital signs, your heartbeat, your blood, how healthy you are, but it also captures your movement data. Where you have been to, places you have visited, etc. And so this particular concept where it captures your movement data has been extended into different applications. So one of the applications that I worked on, you had Francis mentioning that I did my postgraduate degree in New Zealand. I had an opportunity of working with the Canterbury District Health Board. And so I was attached to the Respiratory Health Research Center. And I'll speak more to that in my slide. But they had asthmatic patients. So there was a unit that was primarily focusing on tracking the health of asthmatic patients. So there was these devices, I forget the name, inhalers, that when they're running low on oxygen or something like that, then they would just they would press and then puff it. Yeah. So what happened is that all the inhalers in that project I was working on, there was a GPS chip, and the GPS chip was attached to the inhaler. And part of the thing, metadata or part of the information that was being transmitted to the server was the location where the patient was at any given point in time, and B, it was also able to record the levels of, let me say, whatever stuff they put in that inhaler. Yeah? So it was able to record the level. And whenever the levels went low, then what would happen is that it will alert, an alert will be generated on the database. And then someone from our unit, the respiratory unit, will then call the patient that, hey, you need to come for a refill or a top up. But another interesting thing that I observed when I was working on that project is the fact that the GPS chip was also linked to their calendars, okay? So you know the way you have like a Google Calendar or an Outlook calendar. So it was linked to their calendar, meaning that when you plan to go for a holiday, they will key in the information on the calendar, like, hey, I'm going to be on a vacation from this date to this date. I'm likely to travel to this place, etc. So what would happen is that they would get an alert that, hey, we realize that you're going on a vacation, but kindly, these are the levels of your of whatever has remained in that inhaler. So could you come back and top it up? Yeah. So it was quite interesting to see how how the power of location linked to these vital signs or body symptoms. Besides that, so here we are talking about the advancement in capturing of information. So we are not just capturing, using theodolites and what have you, but we have sensors that are able to read the vital signs. And then in the developed nations, I was reading an article where they're saying that we have these digital doctors. So today, if you fall sick, what is likely to happen is that you'll see your GP or general practitioner, and what they'll do is, I'm talking about Kenya now, is they'll take your weight, they'll take your temperature, etc. Just the basic readings. Yeah? But there's a problem there, and the problem here is that they're only recording, they're only taking measurements on the day when you have fallen sick. Now, what happens in these advanced economies is that there's a gadget, if you can read about it, digital doctors, there's a gadget that is able to read the information from your Fitbit or from your iWatches. So this gadget is able to show your condition, your health condition in the last several months or weeks prior to you falling sick, how your heart has been performing, the level of, activity in terms of exercising, how your sleep rhythm has been, whether you've been getting enough sleep or not. And this gives the doctor, wealth of information on how to effectively respond. Still under capture, we have these so-called devices, drones, and within health, health has actually pushed the limits on the use of drones for data capture. So one such example includes search and rescue missions. Yeah. So in search and rescue missions, they would fly these drones and then identify persons who have been marooned. And what I'm saying is, when we had this project within Kenya Red Cross, and especially during the flooding season of 2019 and 2020, what they did, they went to these parts in Kisumu, and I think some parts of Rift Valley, Baringo, if I'm not wrong. And because of the flooding, they would fly these drones, okay? And as they fly the drone, of course, with the help of the local, with the local guides, they will be able to see persons who have been marooned, yeah? So people standing on top of their roofs because their house is completely filled with water. And then this information, so there you're using drone as a data capture. Then what would happen is that a team would be dispatched, yeah? A team would be dispatched, and as this team is dispatched, there will be someone communicating with them as they row their boat to go and help save the people who have been marooned. So these are some of the, when you talk about information capture, advancement within health, I've seen that being done by the Kenya Red Cross. I've also seen them use these drones to extract, on a sad note, extract bodies that have been washed offshore. So whenever there are like landslides, or flooding, they would send these drones to go and capture information on possibility of life or lack of it, and then this information in the form of images will be streamed live onto a mobile phone screen, and then dispatch team will be sent. Now, still, if you look at storage of geospatial data, particularly within health, health data, I would comfortably call it big data today because of the enormous amount of information that is generated. If you look at just the vital information, we are in the season of COVID right now. So every place you go to, your temperature is being recorded. Every place you go to, your temperature is being recorded. So you can imagine the amount of information that is being captured on individuals at different stages. So we have seen a tremendous growth when it comes to storage of health-related data. Part of these advancements include cloud computing, where information is stored on in the cloud, and of course you will need some means of accessing this information. We've also seen some advancement in terms of standard databases that are able to analyze health data. So before, not so many databases were capable of handling geospatial data, but we have databases like Postgre, where the team came up with an extension, PostGIS extension, which is also capable of analyzing health data. And of course, satellite imagery by its own nature, it also contains terabytes and terabytes of information, which have many use cases, which are very many use cases in health. So we went to Kilifi. When I was doing my undergraduate at the University of Nairobi, one of the things we did was to visit the site in Kilifi, where they monitor these satellites being launched, and we were able to see the kind of information that is normally captured as a satellite is being launched into space. And of course, when you follow that, you then get to understand how these satellite images are captured, and of course, there are varied applications in the field of health, not just in monitoring the health of the population, but also getting to know where health facilities are located, etc. Then in visualization, I've had an opportunity of working closely with the Ministry of Health, particularly starting from March when we had our first case when we had our first COVID-19 case. So a lot of things has really changed. When we had our first COVID-19 case, I would call this like case zero, but forget about those two gentlemen, the lady and the guy who were brought on TV. There was a lot of focus at the coast because a senior person had actually contracted the disease. And so at the time, different government agencies were working together to try and do this contact tracing. And the way contact tracing was being done was, it was through a very manual process, even though right now contact tracing I understand has been automated. Google, in collaboration with Apple, have come up with some applications that are able to, that is able to communicate, but that's something for another day. So my work or my main role was to help come up with a map that would, with a COVID-19 risk map, what you're actually seeing the bottom right photo. Yeah? So it was to help come up with a COVID-19 risk map. We managed to get the coordinates of the individuals who attended the function where we had this senior government official. And once we got their coordinate, we were able to map out their households. And having mapped their households, then the next thing was to come up with if they turned positive, okay, what would be the implication to their surrounding or to where they are coming from. So one of the implications, of course, would be that the disease would spread. And if the disease would spread, then from a health intervention perspective, the next thing would be, are we able to accommodate the spread of the disease? Yeah. So looking at, do we have enough medical equipment? Do we have health facilities that are able to, that are within the reach of the population? Yeah. So we did this health facility coverage mapping based on this data. And once we did the health facility coverage, how many people, or you call it health facility catchment, how many people would typically access the services of a health facility due to proximity. So it was a purely geographic function where you have the coordinator of the facility, you have a raster model of where people are living, and then you sort of you create this catchment based on information from DHIS2 on historical information on how health facilities have been admitting patients, etc. Then you come up with the number of patients that can be accommodated by a facility. Then you go further and start to do some qualitative studies. And the qualitative studies will just look at equipping of the facility, whether it had the necessary equipment, drugs, oxygen, etc., to be able to handle the cases. Then from there, you remember the government then started identifying what we call quarantine centers. So in Nairobi, we had Mbagathi District Hospital, and there were a few others. There were a few others before they later on moved to, they expanded that to the hotels. So the next step was also to be able to identify what would be this quarantine, what would, was to do a suitability analysis. So in suitability analysis, you're basically using existing information, and you're modeling different case scenarios, and your case scenarios are supposed to lead you to identifying the most optimal facility that should therefore be targeted as a target site. Yeah. So that went on and on and on. Of course, the CID was involved in helping track the individuals. These days, that was before we opened up to home-based care. And of course, the rest goes on and on. You have, if you live in Kenya, then you have seen a raft of measures that the president has undertaken. And all these measures that he has undertaken, he always stresses the fact that it's evidence-based. It's basically using information. So the decision to ring fence Mombasa, the decision to ring fence Nairobi, and part of the northern county, part of the northern counties, was to sort of help contain the spread of the diseases, or rather to help contain the spread of the disease. And if you look at how that decision was arrived at from a geographic perspective, it's purely a hotspot analysis. So you have, hotspot analysis is where you have more cases, more cases springing up, and then if there are more cases in a particular geographic locality, then you ring fence it. Yeah? Of course, still under visualization of health-related data, we are now moving into generating real-time visuals, like you're all familiar with the COVID-19 dashboard, the initial COVID-19 dashboard that was able to map out information from different parts of the world. Okay, so real quick, when it comes to health application of GIS in health, you might be wondering, how is it different from applying? Oh, okay, sorry about that. Yeah. So how is application of GIS in health different from applying GIS, let's say, in banking, in the banking industry? How is it different from applying GIS in the oil and energy industry? How is it different from applying GIS in the transport industry, et cetera, et cetera, et cetera? The truth of the matter is that it is not any different, okay? If you're applying GIS in health, if you're applying GIS in transport, or if you're applying GIS in any other discipline, the key concepts are the same, okay? The key concepts are the same. The end result is always to provide a solution, to provide a solution to an existing problem. So when you look at providing a solution to an existing problem, then it follows there are geographic algorithms, spatial algorithms rather, that have been developed to be able to address some of these issues. Of course, you need to have your data. You need to have your data. You need to clean up your data. You need to, in the process of cleaning up your data, the number of techniques which I'm going to briefly walk you through, some of which I've been using in health. And then, of course, you need to clean up your information, explore your data, and present it in a manner that decision makers who do not have any technical background or interest in your field can be able to relay this information to the rest of the world, okay, or to be able to generate insights and come up with interventions. So in health, Kenya adopted DHIS2, which stands for District Health Information System. Our version is version 2 currently. It's been renamed to KHIS2, or rather KHIS, which is the Kenya Health Information System. So this is a system that contains all the information as relates to health, okay, from the facility level. So every single facility in Kenya is required to report onto DHIS2. So there are a number of indicators that are reported. You know, if you look at it, when you go to a hospital, you're either tested, you know, for malaria. Let's say for malaria, you're either tested for malaria, and your results are given back to you. So all this information is supposed to be captured on the system. How many people have been from a facility who are suspected of malaria? And there are so many diseases that are on that system. HIV, even cancer information exists on DHIS2. We have several reproductive health indicators. So the reproductive health indicators here include maternity, you know, number of pregnant women, teenagers who are pregnant, you know, dropping out of school, etc. We have those who have been sleeping under, you know, treated insecticide nets. Yeah, we have things to do with the children who have been vaccinated. You know, once a child is born, they are supposed to be given some vaccine doses, all until I think until they get to 5 years or so. So all that information is stored on DHIS2, and you'll be able to get it. There's information on nutrition, you know, malnourished kids who have reported at facilities, and of course, there's also information on the healthcare workforce. And there's much more. There's much more. I just picked quite a few that I'll be able to share with the team in the interest of time. Then, of course, you have to come up with a tool that you want to use in your analysis. Part of the tools that we typically use is mostly open source tools, even though you can also use a commercial tool. But the commercial tools will require you to, you know, to put in some money. So I've always found it very easy to use QGIS or Python or some of these PostgreSQL in doing my data analysis. Yeah? So since the idea was to speak mostly to applications, so I'll quickly just cover how GIS has been used in health, you know, the application areas. So the map. So the map that I've projected there is a map showing, I don't know how many of you remember the Ebola case in DRC Congo some years back, in DRC Congo. And actually most of it spread and covered most of the Western Sahara. Yeah? So they came up with a very innovative cross-discipline approach to be able to track patients who had been in close proximity to those who were affected. Okay, so they were basically using cell phone signal to track. And how they're using this cell phone signal is that, you know, your phone always always beams information. Part of the information, of course, is your location. Able to track, they were able to track the movement of persons, and as they were moving, they would see, they were able to see the direction of movement, and then from there, the district health officials will be notified to set up these quarantine facilities. They will send them messages via SMS, etc. Yeah. We talked about drones, which is now getting more use cases today, and luckily for Kenya, we already have an act in place that regulates how drones are supposed to be used. In Rwanda, I believe, and Malawi, they have been using drones to save lives, basically by transporting medical equipment. So if you look at the case of Kenya, we have been having some issues with cancer in terms of medical supplies. And so a lot of the issues we have been having has to do with the logistics. The logistics and lack of, mostly logistics and inaccessibility of some areas. I was in, I was somewhere in West Pokot where you might have also seen this video doing rounds in social media where a KEMSA truck had stalled in some river. So because of the poor state of roads in Kenya, of course, one of the things that we will be embracing in the near future is the use of drones for transporting medical supplies. It's been used in Rwanda, it's been used in Malawi, and in both Rwanda and Malawi, they've even set up drone academies. So we are hoping that the same trend will now, will be replicated in Kenya. We're going to see more innovation in terms of the use of this technology for transmitting medical supplies. In Malawi, there was a lady who had undergone a cesarean section, and because she was losing blood so much, and they did not have the required pints, what happened is that they sent the drone to the nearest facility. It was loaded. The required blood was loaded onto the drone. It came back, and then she was given this blood, and she survived. So there are so many examples that we could talk about. Another thing that I wanted to mention is I took part in a project while I was still in New Zealand within the respiratory research unit. We were working on a project on COPD patients. So COPD, a chronic obstructive pulmonary disease. So these were mostly elderly people, and some rehabilitation centers had been set up. And so the biggest problem was that the rehabilitation centers were not being utilized by the patients, So as part of palliative care, the patients were supposed to go for rehabilitation, or rather, as part of the rehabilitative care, they were supposed to go for rehabilitation, where they would be, they would do all these cardio, physical exercises, just to sort of open up their lungs, etc. But the services were not being utilized. And so the district health board wanted to know what is it that is actually contributing to patients not going to the centers. And so ours was a geographic approach. So we took a geographic approach to the problem solving, where we mapped out the locations of the patients. Then we mapped out the location of the rehabilitation center. Then we did this distance, we created this distance matrix. So the distance matrix was basically how far is a patient from the next rehabilitation center. And then we realized some very glaring differences, like some were actually were living very far away from the rehabilitation center. Then we came up with an hypothesis, like we came up with a solution rather that what if we change the rehabilitation centers and assigned people the rehabilitation centers that were closer to them. So you can imagine, if I were to localize this, imagine moving from Nairobi to Mombasa to seek care when there's a center in Machakos. So would you rather go to Mombasa or would you rather go to Machakos? Okay, so that was the approach that we took. First was to come up with a schedule that accommodated the geographic location of the patients. But secondly, we came up with proposals to carry the patients to the centers, okay? So that meant that they did not need to use their fuel or anything like that. Yeah? And so in order to do this, we were tasked to make recommendations on the type of vehicle that would carry them, and of course the best optimal route that they will follow. Okay, so the optimal route basically this is a simple analysis that basically it's as we call this as traveling salesman problem. Yeah, sorry, I almost confused it with as the profiles. So traveling salesman, where you have all these different nodes, and the nodes are where the patients are living, and you need the most effective route to travel through the nodes, the most efficient time, picking these patients, and then of course dropping them to the rehabilitation center. So that is what we did, and we came up with this transport, the most optimal routes and the time when each patient would be picked. And so this information was provided to them. And sadly, I did not see that project being completed because I had completed my studies on that. Then, of course, closer home, I've also been working on HIV analysis. And this is an example, part of the work that we've been doing on HIV analysis. So as you all know, how HIV is transmitted from two partners having unprotected sex. So what happens is that throughout that process, or rather two partners engaging in risky behaviors. And so these risky behaviors, of course, puts them at a situation where they can easily contract the disease. So our main objective was to identify the concentration, or what we call the hotspots. Yeah. Do we have trends of hotspot? Do we have areas where there is a high concentration of the disease compared to other areas? Okay, so we came up with this map. These are basically the steps that we followed. Get into GIS2, pull all the health facility-based data, plot the facilities based on the number of patients who have reported to that facilities, and plot also, map out those who turned positive. So you come up with a positivity index per facility. Then the next thing we did was to create like a heat map to be able to know the high concentration areas. So when we came up with the heat map, like the map you're seeing here, immediately you'll observe that the red hot areas are basically bordering a water body. And so there's always been this joke that if you want to end HIV, then drain the lake. Once you drain the lake, then there'll be no more disease. Okay, but that's just a big joke. But so we observed the patterns and trends that there was some, they were highly concentrated along the lake region. And then the next thing we did was to find out what is it that was actually fueling the disease in those particular areas. Then we discovered, the economic activities, the levels of education, et cetera, et cetera, et cetera. So because of a high economic activity in the lake, then there were interventions, The next thing we did was to identify, whenever the health care officials are going to visit the sites, then they would they would provide them with information on how to, change their risky behaviors into unrisky behavior, or something closer to that, the ABCs of abstinence, et cetera, et cetera, et cetera, yeah. And then of course, from a public health perspective, once you have intervened, either by provision of ARVs or by provision of key messaging, then you need to also measure the effectiveness of your intervention, okay? So we measured the effectiveness of intervention by mapping out those whose viral loads had dropped to below, those whose viral loads had dropped to a level that they could no longer transmit the disease. So what happens is the more you take the ARVs, etc., then the more you get suppressed. Your viral load is suppressed, what we call viral suppression. So there's a certain threshold that if you reach, then you can no longer transmit the disease to another partner, okay? So, but don't try this at home. Huh? So what happened then is we will then map the effectiveness of the intervention, and then that will be like the success story. So if you look at that entire process, it's purely a geographical case. Now, I'm reminded that I've spent more than 40 minutes, and so I'm going to just, I'm going to quickly speak about the tools, yeah? So if you use R or Python or QGIS, then you have so many tools at your disposal to do health modeling or health analysis. Eh? So you can easily find these tools within the processing toolbox of QGIS. One great tool, of course, is the geostatistics tool. It allows you to do all your regression. But since this is not an academic class, I will not touch on this. I just wanted to mention to those who want to venture into this space, what do they need to be abreast with? Of course, make R your friend, make Python your friend, make QGIS your friend, and of course, statistics. Yeah? Make statistics your friend. Okay, so lastly, I gave you lately we have been working on this project. And this project, it's a relatively old project. It was done, was it in 2019? Yeah, I did this before moving over to developing geo-enabling platforms. So also just to mention this to you is we were approached to come up with, these polio vaccines or immunization. Eh? So we wanted to come up with an effective way of directing MOH staff to visit every single household, okay, without necessarily duplicating duplicated efforts. I believe the same approach should be used by KNBS whenever they're doing census. Maybe that will be, an approach that we can propose or recommend to them. So the approach is very simple. The first thing that you do is get the area of interest. So this is, we want to do our immunization in a sub-county called Kisii, for instance, yeah? Bobasi in Kisii County, yeah? So get the polygon or the shapefile or the GeoJSON file, basically the boundary data. Once you've gotten the boundary data, then provide additional layers, layers could be health facilities, areas of interest like schools, etc. Then generate a grid, okay? So we have these grids, there could be so many, depending on your area of coverage. Then overlay your grid with a satellite imagery, yeah? So there are so many sources of satellite imagery. The highest resolution is Maxa, but you can have several others, even within Google. You could also use Google Cloud Computing Engine. Then once you have overlaid your satellite imagery, now you're able to see the households and the road network, etc. Then what we did then was to invite the healthcare officials the healthcare officials onto a room, and we projected these Google images, okay? And we projected these Google images to them so that they may be able to plan the routes that they will be using. So we had teams of 5, teams of 6, depending on how big the area is. And they would basically familiarize themselves with the area that they're going to cover without necessarily going over to another place. So an example is, I don't know how many of you during the census, you had more than 2 officials knocking on your door, then you had to tell them, oops, somebody had actually come here, okay? So in order to avoid that kind of a thing, we sort of developed a geofencing application that basically, if you move out of the fence, then it alerts you that, hey, you're now moving out of the zone. So before, and we had to do this manually first so that every person could be familiar with the area. So you see the bottom right map there are the markers, and the days. So they would, they would say, we will be here on day 1, we'll be here on day 2, we'll be here on day 3, we'll be here on day 4, and so on and so forth, okay? Then the last thing we did is interpreting satellite imagery is not that easy. So we sort of complemented that with the 360-degree camera, Google street level images. And with the 360-degree Google street level images, you can actually pan, zoom in and zoom out and be able to see people, vehicles, roads, curb row, etc. right? So with those, then what happened is that they were able to contextualize where they were at. And of course, lastly, we sent the teams on the ground. We had a team of volunteers who would then go to the ground to collect information. And as this information was being collected in real time, we developed a dashboard using Power BI. And every time a submission was made using a phone, the information will pop up on our screen. So we call this, where we call it the EOC, or emergency. Typical for an emergency operations center. Yeah? So we set up like a situation room kind of a thing where you have these big screens, and then the information from the ground would then be projected onto the big screen. And then you'd be able to now, so once the information was projected, we were able to identify, households that were missed, okay? So if a household was missed, then what happened is that some information, there was an R script that was developed that would then send information to the supervisors that, hey, it will first generate a map and send that map to the supervisors, highlighting areas where they had actually left out. Then, of course, the heat map. With those very many remarks, that is the end of my presentation. Thank you. Over to you.
Okay.
Francis.
Yeah, so thank you so much, Benard, for the exciting presentation. I know there must be questions. Who wants to go first with a question? As we wait for them, I could ask a question, because I was noting a number as you progressed. At some point, you said that health data has become big data. And you spoke about the need for advanced skills, machine learning, and cloud computing. And having passed through the same classes that our students here pass through, how can a student in geospatial science in developing countries like Kenya leverage the knowledge that they learn in class to make sense of the big health data that you are handling? So that's one question. And related to it is, when people come to do geospatial courses, either they are interested in land surveying, engineering surveying, GIS, remote sensing, but like the data that you're handling, it's beyond these classical geospatial skills. So what other skills does a geospatial engineering student need to be able to participate in the big geo-health data analysis? Thank you.
Yeah, you always ask very tough question, Francis, but I'll try and yeah, I'll try and answer to the best of my knowledge. So let's start with the skill sets. Yeah. So when it comes to the skill sets that you require, remember in my presentation, I said something like there isn't so much difference between application of GIS in health and another sector like transport. Because especially for someone who has the fundamental training. So the fundamental training here is the scientific principles behind geographic information, being able to understand the scientific principles of geographic information. And these principles is standard, okay? You have your vector data, you have your raster data, you have to understand the topology of this data, you have to understand the properties of each of these data sets, okay? For vector data, of course, we're talking about coordinates, polygons, lines, points, points, polygons, and lines. So you have to have a very firm, you have to be firmly grounded on the scientific principles. The problem we have today is that a lot of the people who are getting into GIS, they're getting the application knowledge rather than the scientific knowledge. Okay, so the application knowledge here is they go on to YouTube and they learn how to use a tool. Okay, so they are quite good in using a tool. Take ArcGIS, for example. These are people who have mastered ArcGIS. It's on the palm of their hand. You call them in the middle of the night, they'll tell you, oh, just click this button, click that button, click that button. Yeah. But they really do not understand why that button is being clicked in the first place, okay? Secondly, if there's a change in the design of the software, then they're completely lost because now, they'll be saying, oh, I can't see this button. So I think when it comes to skills, first, you have to be grounded on the scientific knowledge of GIS. Number two, the rest are now, once you have been grounded in the scientific knowledge, the rest are now personal skills or human skills. You have to be very proactive. You have to be very proactive and very up to date. Like the examples I've given you are pretty much COVID related because it's the in thing right now. So you have to be able to translate your knowledge into solving a problem. Like for us, the problem was COVID-19, and the problem was how do we effectively solve COVID-19? Okay, it's still a problem as it is, yeah. But you have, as a GIS specialist or expert, you have to take your space in that environment and assert yourself like, hey, I can do this for you, I can do this for you. I can, let us lock Nairobi, and I want you to lock Nairobi, shut down Nairobi because this is the data I have. And so besides being grounded, you have to be, human skills, follow the current affairs, be proactive, especially be proactive in this in different health forums if this is what you are going to be pursuing, and try to how are you going to translate, think outside of the box. How are you going to translate the knowledge you learned into solving real problems? Of course, the rest of the things will always fall in place. One of the things I've seen people do these days is, they open a YouTube channel, open a WhatsApp channel, and this YouTube, WhatsApp, or even a Twitter account. Keep on commenting about current affairs, develop maps, post them there, give your opinion on something, either on LinkedIn, tag the industry players. Every time you do something, tag the industry players, okay? So if you do something, like in my case, whenever I'm doing some of my work, I would tag renowned figures in the ministry or in the institutions that are associated with this. Yeah, Then as a result of that, of course, then they'll reach out to you. The other question you asked was leveraging big data, machine learning, etc. Yeah, I think it's a good question, because from where I sit, when sometimes I look at the future of GIS and what is currently happening, there will come a time when, just like what happened to surveying, there was a time when you could study surveying for 5 years, and then when you go to the rural villages, it's the diploma folks who are measuring the land and doing all the work. So I kept on asking myself, where are the certified surveyors? Where are these people? Because all the work has been taken by those who used to pull chain links and what have you. Okay, so there is a real danger in the sense that GIS is slowly falling into that category. If you look at most of the job advertisements, okay, the position being advertised is something else, but the skills required, there's a line, must have GIS capabilities, okay? It's just a single line. So what is happening is that because of the demand, everybody is taking a side course on GIS. Everybody is learning how to use a tool. And that means that we will get to a point where everybody knows what GIS is except what it is, okay? So that is why I always say, go beyond the field of GIS, okay? If you are applying, once you have your foundation in GIS, then get an additional type of skills. Like in my case, I have majored in health. So sometimes when I speak, you think like I studied health, but I really did not, it wasn't my first degree. It's just the interest of knowing what is happening in health and marrying the two together. So I have this health on one side, and then I have the GIS on the other side. And in between, I have a range of other skills. You have programming, where machine learning, big data falls in, okay? Then you also have this, visualization, developing dashboards using, Power BI or Tableau, etc. Okay, so you just have to expand your knowledge base for you to be able to survive. Thank you. Any other question?
Thank you. I'm hoping somebody will type a question, but before no one has typed a question yet. Geospatial is, there are many facets to it. There are many subject areas that somebody can pursue. And normally for our students, sometimes this is a dilemma, in the sense that you are good in cadastral surveying and you feel GIS is the weaker, or you are good in engineering surveying or adjustment theories, and you feel that remote sensing is slightly lower in terms of the content that is there. But even from the examples that you've described, I see that it is integrative. For example, the example that you've just given about identifying health facilities, identifying households that have been built. I believe if we had a proper parcel management system, where we know this parcel belongs to this person, this is the use of this parcel, and these are the potential households in this parcel, then somebody applying a GIS with this kind of background database will be at a good place. So what will you say about, especially for the students who are earlier on, what would you say about, is there a need to integrate these fields, or they should start specializing as early as possible? You understand?
When you're talking about the parcel management system, I think if you watch the news, the CS Farida Karone, I think, launched this geospatial center, and for instance in Nairobi, all the parcels have been mapped. So there's a cadastre existing there. Now, in terms of would I recommend specializing or or integrating. Okay. Now that's, I think that's an academic question, because it is something that has been discussed for the longest time, the pros and cons of specialization vis-a-vis the, knowing a bit of everything, okay? So, so I'm going to say two things to that, again, based on my experience. I sometimes read these business books because I also want to understand how business works. And one such book that I read, I think is called Rich Dad, Poor Dad. I think it's like one of the bestseller. Everybody has read that book. And in that book, Rich Dad, Poor Dad, there's a place where he says that if you want to succeed, then you need to know a bit of everything, okay? Such that if one door is locked, okay? So let's give the example of a banker who only specialized in counting money at the counter, okay? So when the ATMs came and they did not have any other skill sets, so their profession was basically, they were completely wiped out because there was no value for them, yeah? So they had to acquire newer skills. So if they only knew a bit here, a bit there, a bit there, then they would easily find their ways into other things, okay? The other line of thought, so that is from a business perspective, the more you know, then the more likely you are to make more money, okay? And the faster you are to move in your profession. The other line of thought, the pros for specialization, is the fact that those who specialize always make much more money. Those who specialize, because specialization it's a niche skill. You have to dedicate lengthy hours on the subject matter for you to be able to understand it well, and for you to be able to call yourself an expert. Yeah, a lot of the times I see people calling themselves, GIS expert, but they do not even understand the topological. What is topology? They don't even understand that. Yeah, so there is, I would say, there's dangers to both. Yeah, there's goodness in specializing, but there's also goodness in learning a bit of everything, okay? But for startups, okay? For startups, I would usually recommend learning a bit of everything, knowing how things work as you try to find yourself. Then later on, as you mature in age, then you pick one area that you want to focus more on. So if you are an undergraduate or you're just about to graduate, yeah, I would strongly recommend that you take this rich dad poor dad approach of learning everything as much as you can, yeah, because a typical job environment, you will be hired as a GIS specialist or GIS analyst. The truth of the matter is that you will never, chances of you making a map on day one are very slim. When I got into Cambridge, the first time I ever made a map was in my second year of employment. A lot of the times I was just assembling data sets and writing reports. Yeah? So I started making maps towards the end of the second year. So the chances are that by the time you are getting into employment, you need to have learned a number of things, yeah, so that's all I can say without really repeating or duplicating myself. Thank you.
Okay, yeah, so I would want to ask one question, and then also you could add it with your concluding remarks. Most of the participants that we have are students, undergrad, who are just getting into the field, and sometimes they attend such forums to be able to listen to an expert so that they can also orient themselves. So the question the final question that I have is on mentorship. A lot of, because apart from my private work, I also teach in the university. And one of the gaps that students continually highlight is mentorship, in the sense that the lecturers teach them well, but there seems to be a gap. The people who are doing well in the field are doing well and progressing in the field. And there seems to be a gap in people in the field holding the students and mentoring them through the process. So are there particular linkages, other particular resources for mentorship that you could highlight to students who may be interested in such opportunities? And then apart from that, just your concluding remarks, just your words of encouragement to students who may be interested in the field. What are some of the key things that they need to look at to become, to be successful in the field?
Okay, I take it that no one, before I give my concluding remarks, I'd like to ask if there's anybody who has a question. You can raise your hand and then we'll be able to give you a chance to ask a question. So on mentorship, this is a very good question. And to be very honest, I really do not have an answer for this, because the way our organization, or rather the way our culture is today, the most direct entry to mentorship started with internship, okay? So what happened is that students who are at the university level, they would be interned, okay? So during the internship, they would have people who are basically holding their hands and telling them, hey, do this, do that, do this. I personally went through that process. You know, I did my internship for 4 months at Esri without pay. And, you know, it wasn't an issue for me that I was not being paid, because I knew what I wanted in life, you know. So every day I used to walk from, you know, University of Nairobi. I would walk through Uhuru, I think it's Uhuru Park, to Upper Hill, Cusco Center, 3rd floor, every single day, whether it rained or it did not rain. And that's how I was able to do my 4 months, you know, without pay. But I do not regret it, because when I look back, part of the things I used to do there was I was given these huge books, you know, huge books on ArcGIS. And I would read the books and do the practicals, read the book and do the practical until I finished all the books. And that was month number 3. Later on, you know, the organization would then hire me as an account executive to help in selling the software that I had learned so much about, yeah? Where I thought now I was, you know, you have just done your geospatial engineering, you feel you're highly technical, but then you're thrown into the marketing department to sell the software, okay? So the first thing is seek out opportunities that relate to internship, number 1. Number 2, when you get this internship, some internship do not pay. Like in my case, 4 months without pay, all right? The problem we have today with the youths is that, especially this younger generation, they want money upfront, you know. Today, somebody shows up for an internship. After a month, if they have not been paid, they start to complain, oh, those, you know, and then they don't show up, you know. So because they're not being paid, then they leave. You know, some people even boldly will ask, you know, how do you want me to come to the office? So do not have very high expectations on yourself when you are interning as relates to money. The only expectation you have is to stay focused, learn as much as you can in an organization. Now, the other thing is that I think it's also a failure on us as professionals, okay? A university lecturer would teach the students every year. You know, you are churning out graduates, you know, in their hundreds of thousands, eh? But there's no linkage between the universities and the professional environment, yeah. So this is something that, again, you know, like you said, you also teach at TUC. I would also pose it back to you, like there used to be, if I tell you how I got my internship at ESRI is because I studied at Strathmore University, and because I studied at Strathmore University, the managing director was a student at Strathmore University. And so one day, I just gathered courage, and went and spoke to him like, hey, I know you are in charge of ESRI. I'm studying geospatial engineering. Do you think you can be able to hire me? So I just wrote an email, and I was really crossing fingers and biting my teeth, and then I got my feet. So you have to take that bold move as a student. Do not fear. Do not overburden your parents to school you, to look for jobs for you, so take that move, The university that I was just about to add, Francis, is that the university needs to create a placement center, a placement center that links with the professionals. So you need to find a way of tracking those who are already doing so well in the industry, okay? So I'm sure you have those who graduated in 2000 and below who are already at the managing director level, These are the people you can write to as a university seeking, asking them to give placement to some of your students. Yeah? Then lastly, as professionals, again, we have also failed because the last time I ever went back to University of Nairobi just to update my lecture on how I'm doing, I can't even remember when I did that. We only meet on these kind of forums. Yeah? So we also, I think it's also on us as professionals to be able to give like thanks to the universities where we came from and ask them to assign us some students whom we can handhold. Thank you.
Okay. Thank you. There are two questions that have come up as you are speaking. Thank you for the very good answers. One is on what is the difference? Is there any big difference between ArcGIS and QGIS? And then the other one is Sam says he's interested in Power BI. Is interested to know how to connect Power BI to be able to receive live feeds from the field in the Red Cross job. That is, I think, a practical question. Yeah. So if you could address those two.
Yeah. So the first one, the difference between people who use Arc and people who use QGIS is there any big difference between these two softwares? So there's not much of a difference between the people. If you ask the difference between the people, then there's no much, because myself, I use Arc and I also use QGIS, so there's no difference between myself, right? But between the softwares itself, one is an open source tool and the other is a commercial software. And if you've been following the discussions, we have this thing we call global public good, which means softwares that are open source. So there's a lot of focus on open source tools, okay? Free to use, free to download, free to install, and of course the sustainability aspect of it. Yeah? So ArcGIS is relatively expensive, and so if you can afford, then go ahead, use ArcGIS. If you can afford or your organization can afford them. As students, they always give student licenses, which is about, I think, $100 per year. So that's around 10,000, okay, per annum. And so you may, if you have that amount of money, you can use that to buy your software. But if not, then learn to use QGIS at an early stage. In fact, I always tell people that I learned QGIS from Francis, because I was such a ArcGIS diehard that I did not believe there is any other software that can do what ArcGIS does until I saw the maps that Francis used to create using QGIS. And then I just started developing an interest up to the point where we came up with this QGIS Kenya user group, which I'm currently leading. Yeah. The second question in how do you connect Power BI to receive live feeds? So Power BI has what you call connectors, multiple data connectors. So one of the connectors is a web connector, meaning that you can connect to the web. So the data we were capturing it from Kobo Toolbox, and Kobo Toolbox has what you call API, or application programming interface. So with an API, it gives you access to that data, so long as you key in the required credentials. So what we did was basically to key in the API credentials of Kobo Toolbox within Power BI, and that way, every time information was uploaded onto the dashboard, every time information was uploaded onto Kobo Toolbox, then we were able to refresh our dashboard and then see it in real time. Okay. Yeah, so I hope this is not the Someone Joy that I know. There's another Someone Joy I know who has been doing quite a lot of work on QGIS. I hope he's not. If he is, then I salute you, Sam.
Okay. Yeah, so there's as we get to the end, there's another question that is coming up from Evans. It says there's a lot of information to learn out there, but how do you choose which one to learn? For instance, as a geospatial graduate, I need to know how to use ArcGIS, QGIS, R, Python, Google Earth Engine, ERDAS, etc. at the same time. So how do you prioritize? How do you prioritize? Which I think is a very good question.
Mm-hmm.
Yeah.
So I don't know. That's a very good question, but I'm just going to answer your question with a very simple joke. How big is the brain, or how much can the brain accommodate? Yeah. So the brain can actually accommodate so much, that if we are not learning these things, then we are basically underutilizing our brains. I really get offended so many times when I see I have a three-year-old kid. My kid can spend countless number of hours on a phone until he sleeps. He can use the phone from 8. If you don't want any disturbance, just give him a phone. That's what we normally say. So you give him a phone, you will hold your meeting in peace. If you have full day meeting, he will spend the time on the phone until the battery runs out. So, okay, the point I'm trying to say here is if a child can spend more than 12 hours or even 8 hours on a phone, how much more can we do to develop our brains, okay? So, yes, indeed, there are so many tools. We have ArcGIS, we have QGIS, we have R, there's Python, there's GEE, there's ERDAS. Obviously, you can't know all these tools. One of the things that will help you in prioritizing the tool is the job that you're doing, okay? Now, I came to learn that from experience, I came to learn that instead of mastering all these tools, all I needed to know was Python, and I was sorted out. Why? Because with Python, you can do remote sensing. With Python, you can do GIS. With Python, you can develop dashboards. With Python, you can do your data analysis, etc. So I think I would always say that rather than learning, now let me spend 1 hour learning ArcGIS. Okay, done. Now let me spend another 1 hour learning QGIS. Try to find what is common in all these tools. Python can be used within ArcGIS through ArcPy. The same Python can be used within QGIS through QPy, okay? The same, I'm not so sure about ERDAS, but ERDAS is largely remote sensing software. So Python has the capability of processing remotely sensed images. Even within Google Earth Engine itself, you can select which programming language you want to use, and one of them is Python. So here's a result from search. I would always say that try learn that which cuts across, like a software that is double-edged sword. Like Python is a double-edged sword. It cuts on both sides. Then instead of ArcGIS, learn QGIS. Why? Because you are likely to work for an organization that does not have an ArcGIS license. And when you're telling them, now to make this map, I need you to pay 100,000 every year, they may not take it lightly. So learn at least one open source tool, learn at least one programming tool, know those ones very, very well. And then the rest, learn on the job, because the different jobs also have different softwares. My current job right now, the Geo-enabling initiative, we are mostly using Kobo Toolbox, okay? And of course, Power BI, yeah? But before that, I was using all these other tools. Thank you.
Okay, thank you very much, Benard. I've just put your email so that just in case somebody wants to get in touch, they can get in touch. I know you will also share the slides with me, and anyone who wants them can either get in touch with you or get in touch with me, and they'll have a copy. We've also recorded the meeting, so it means somebody who wants the link to the meeting can a copy of the video can also get it. Otherwise, thank you very much for the presentation, for preparing the presentation, and also for the very realistic responses that you've given to the questions that we have. And I also want to thank the people who volunteer to be able to come. This is something that we do, and it's part of mentorship and part of capacity building to at least know what other people are doing. I know there are students who approached me later on after a webinar and told me that, hey, I'm interested in this topic because this person presented. And that is really the goal. So thank you, Benard. I hope you will not get tired by our continuous calls to come and present. Some days we'll call you to come and demonstrate practically how to use Power BI. I hope you don't get tired of my calls. Yeah.
Absolutely.
Yeah, so thank you very much, everyone. I think with that, then we call it a day. You can now leave at your pleasure. Thank you.